Give an example. So you just had a basketball player who tore their ACL, and now they're starting to progress, and they're maybe 3, 4, 5 months post-op. What kind of decisions and what kind of things do you look at to start making appropriate and safe decisions for them to return back to play? Because that's as soon as they get injured, the first thing they think about is I can't wait to get back on the court. I can't wait, get back on the field. So what steps do you take part of the plan of care to determine when it's safe and appropriate for them to start returning back to some level of play?
Yeah, so things, objective measures that I have into consideration, range of motion. Okay, let's talk about every joint: shoulder, hip, knees. Range of motion, achieving full range of motion, it's very important because lack of terminal range of motion has been proven to increase the risk of re-injury. Muscle strength, okay, has to have a similar muscle strength compared to the contralateral limb, okay? And one thing that is very important, and neither you guys or myself can control, is time to healing. Mm-hmm. Okay, let's take an ACL, for example, because ACL rehab is one of the most rigorous, is more, frustrating for the patient, especially young athletes that, there are three months after the surgery, they feel fine, they think that they can do it all. It's biology, and the only one that controls that, it's God. Because one thing is the technical aspect, okay, which is the surgery, and that's my goal. You need to have a good technique during the surgery. Second, it's physical. Once you're getting ready to go back, that you need to meet all the checkpoints, like balance exercises, that you have good balance, you got good strength on your lower extremity, and you have motion. But one thing that nobody can control is the time that it takes for that surgery to heal. On an ACL, the time it takes for that graft, that rebuilt ACL to reintegrate, incorporate in your body. And in the ACL, it's been shown that you need to have at least 9 months. There's a lot of controversy. There are some schools that say that you can go earlier, but going earlier increases the risk. When I was training in Houston, the NFL athletes, sometimes they could go back at around the 7-month, 8-month mark. And that's because that's all they do. They don't work. They don't study. They don't have to do chores.
That's their job.
They do 24/7 is physical therapy, training, rehab. And in that setting, you can have, an athlete, because the body type of those athletes is like a superhero body type.
Yeah.
I mean, they're big, they're fast, they're agile. So genetics has a component there, but the great majority of the ACL rehab, returning to sports, in my practice, is 9 months. The older you are, probably takes a little bit more. So I will say 9 months to 12 months for the surgery to heal. But also, before you go back, you need to pass the checkpoints, pass the return to sport testing exams that you guys do for the ACL, and you need to be strong and have good range of motion. So it's a component of things, and sometimes my role and your roles is protecting the patient against themselves. So when I push, and they try, you see that a lot. They try to push. Hey, do you think I can go and run? Do you think I can go jump? And we're like, no, you're not ready yet. You're not ready yet. So that's very important for people to know.
And working with ACL patients, it's fun, it's challenging, but yeah, it can be like Groundhog Day for the beginning and middle part of that, because it's just rigorous. Like you said, day in and day out, you just got to put the work in. Talk about the objective measures. I think it's extremely important, and you're doing an injustice to the athlete who had the ACL reconstruction if you don't go through a fine-tooth comb. So, a subjective examination is key. Being objective as far as having the Y balance, which measures 3-directional movements, comparing your left and right extremities. We also use a Dartfish video analysis app where we will take you through different movement patterns. The beginning phases are, double leg squatting, inline lunging, and that progresses to single leg squatting. And towards the end, we're looking at more of that dynamic stability where we're having people, run, cut, run side jumping, doing the agility ladders, making sure that everything looks good. Because as you said before, the injuries are going to happen with fatigue. So we want to make sure that everything from a mechanic standpoint stays crisp and clean all the way through the end of the game, so that way nothing, no issues pop up later.
And I think also an important part of the video dart-based analysis is positive biofeedback. So, you show the patient, hey, this is how you should land. You're not there yet. And the patient sees it.
Yeah.
And then he can put the work into correcting those deficiencies. And then at the end of the program, the patient can compare, I wasn't quite there yet. Now I'm there.
Yeah.
So it's a very important tool on the rehab process.
And it's measurable.
And I think what that all amounts to, which I think is paramount for the ACL patient that I'm hearing, just not having said, is education. So much of what we have to do as practitioners is provide realistic expectations and education for our patients. And Dr. Perez, I need to commend you, because so oftentimes I feel bad for the orthopedic surgeon who, because there's so much media publicity about Russell Westbrook getting back and playing at 8 months, or Kyle Schwarber getting back playing at 6 months.
They're gross.
Yeah, they're setting the bar at such unrealistic expectations, and it's our job, both as the surgeon as well as the PT, to kind of back up your philosophy, is to make sure we're educating our patients that healing is different from how good you feel. You'll feel good here, but healing will take all the way to here. And this is why these objective measures of very specific strength and balance and very challenging movement patterns that you need to perform need to be checked off the box. And why it's so good to have a working relationship with a doctor who we as PT speak that same language as you, and vice versa. What can you tell us about that thought process when you have that patient in your waiting room, that the question is asked, well, doctor, when can my son or daughter go back to playing sports? What's that conversation like for our viewers?
Right. So the thing here is managing expectations, right? I think most of the athletes, let's talk about an ACL. Most of the athletes, because it's out there now, a lot of information and social media and on the web, they know that ACL is a season-ending injury, okay? So if they're in the middle of the season and they get an MRI back and they have an ACL, that's the first thing I tell them. This is a season-ending injury. So you're not going to go back until next season. Now, the issue with athletes, which is, I wouldn't say it's a bad thing. They are involved in multiple sports. And I say it's a good thing, because, specialization in one sport is not great for a young athlete. But, it's important to establish what are your goals. I tell, once they have the ACL, say, okay, so basketball season is done. What is the next thing you want to get back to? Okay, because you're clearly going to be out for 9 months. And as soon as you tell them the time frame, 9 months, they can start getting their expectations on check. And they have, I have a talk with parents as well. And then I go and try to tell them, what is your sport? Are you on a scholarship track? If you're on a scholarship track, what is it? Is it for basketball? Is it for baseball? So we need to narrow down, all the sports that they do and kind of focus on one common goal. And that's the approach I try to take, because you need to manage the players' expectation and the parents' expectations. And they are some of these athletes are under a lot of pressure because they're being scouted, and they want that's their way to college. But we need to deal with the injury that's right in front of us and let them know that the younger they are, the statistics are in their favor to get back to sports. So, you're taking a multidisciplinary approach with you guys. The athletic trainers, the coaches, also important for them to know what to expect, because these athletes also feel the pressure from the part of the coaches. So I try in my office to, have direct line of communication between the coaches. I have an athletic trainer that works for me as a physician extender, as well as providers like you guys that, keep me informed via email, via text. on how a player is doing. So every time I see them on the office, I can tell, yeah, you're right on track. No, we need to work a little bit more here. So that's the kind of approach I like to take on this patient.